I'm just really happy to be here. I was reading through the rationale for the Icon Summit, and so I just feel delighted that I get to be part of this conversation with you. I spend my days working on gender equality globally. I work at the United Nations Foundation. I'm our vice president for Girls and Women's Strategy, and so I spend my time thinking about equity in that context and across things like education and safety and health. And so I just love it when I get to peek into other worlds where gender and race have outcomes or affect outcomes in ways that they shouldn't. So I'm also a proud member of the Livestrong board of directors. I worked at Livestrong a long time ago and still consider myself part of the family. So it's a delight to see the ways in which Livestrong has grown and thrived. And also I'm just really proud that Livestrong has taken on this issue of racial equity and gender equity in research and cancer care. So thank you for including me, Kim. Thanks for including me. Jasmine, I was reading a bit about you. You're amazing. Susan, can't wait to get to know you.
Yes, thank you, Michelle. Thank you. Well, we are honored to have you all today, even if it's a small group of us. I did want to set the stage a little bit for what we're about to gauge in. For the past 18 months, we've had many conversations and hundreds of people collecting input and, ideas around potential solutions for some of the most challenging issues in cancer survivorship for communities of color. Mm-hmm. Today, we're going to ask you, our little small group, to help truly narrow down what we could focus on and potentially solve with funding during the 2022 grant cycle. So here's what we're about to talk about and what we've talked about so far. So let me share some slides. This is kind of a recap maybe of the last 18 months. So yes. What we have talked about. So bridging the digital health literacy gap, establishing trust through technology, reaching women of color. Did anyone partake in any of the previous icons where we discussed these? The recordings are on the website. They are intense, I have to say. They've been very phenomenal to be part of. And solutions we've surfaced. So an app, that was pretty neat, talking about literally creating an app or a database to help find others of similar journey with a similar background. I feel like we have kind of similar thing with social emotional support with the peer-to-peer, culturally appropriate and relatable education materials, which empower patients, middlemen in the clinical setting. I really like this one where you can kind of go from one office to the next. So imagine going to the oncology office and then going straight into another type of clinical setting, and create a network of people from the community others can trust. So I think, and the big word to take away from there is trust in that for sure. Wonderful. So let me just introduce Jasmine. So thanks for putting up with all of that. But now I'm leaving the hard part up to you. Your guide for the discussion is Jasmine Sowers. And just to give a little bit about her, at 26, she was diagnosed with breast cancer. After 25 rounds of proton therapy, she realized two things. Number one, her friends and family helped her through and through. And two, there were not images nor resources really for women of color online who were facing breast cancer. So she partnered with fellow Instagrammer Marissa Tomas and decided that since they couldn't get a seat at the table, they would build their own. Co-founding The Breast of Us, Jasmine is a passionate advocate for women of color affected by breast cancer. She believes in the power of sharing the voices from marginalized communities to break barriers in the cancer community. Jasmine, the gallery is yours now.
Thank you so much, Kim. Thank you so much for having me. So is it possible to keep those slides up, the ones about the solutions that have been discussed? So I guess the first question we could ask is, if only one of these things could be done by Livestrong, where do you guys think they could move the needle the most? Where do you think they could have the most impact if only one thing could be done?
Ooh.
So some of the things that I've been thinking through are, there are similar apps like that. So if we think about Livestrong creating an app, how does it need to be different from what already exists?
Mm-hmm.
Jasmine, at the beginning, after your diagnosis, which of these 4 things do you think would have helped you the most? Like, especially imagine you had a powerful group of family and friends, it sounds like.
So I was actually initially misdiagnosed. I was misdiagnosed at 25, and I was diagnosed accurately about 6, 7 months later. I did a bilateral mastectomy. I did proton therapy radiation. I did hormone therapy, hoping to finish hormone therapy the beginning of next year. For me, I think one of the most daunting things was the education materials. I found apps, I found like other communities where I could find people. I had a nurse navigator, though I understand that not every hospital setting has the option for a nurse navigator, but that person was more of the middleman for me. My hospital also has a social worker. So when it came to overcoming barriers, that's the person that I would speak to. So one of the issues that I found was that being diagnosed so young, I didn't really question the doctor. I didn't realize that mammograms and ultrasounds weren't effective screening methods for young women, women under 40. And so when I received the paper that said, like, you can do additional screening, I assumed that that was the additional screening. But it took me to get to a specialist that did a different kind of mammogram and ultimately a breast MRI. And so now one of the things I tell women is, like, you have to know what you're asking for. But there aren't a lot of materials that lay out all the options that way. What For the Breast of Us has done, at least in the breast reconstruction space, is we've partnered with Mentor Breast Implants by Mentor, and we just created a one-pager that listed out some of the most common breast reconstruction options, because we realized women of color often weren't getting options. I know I didn't. I was basically told, this is what we're going to do. So I think for me, the biggest gap is still in the educational materials.
And then what would be the best way to, I'm so curious about this now. What would be the best way to deliver them? Is it being delivered through a person you can trust? Is it being delivered through an app? Is it being the educational materials?
I think that's interesting. Living Beyond Breast Cancer just did a study for their demographic in particular, and it actually showed differences across cultures for the way that people like to receive information, which is interesting because the study that was done a while back about clinical trial participation in Black and Latina patients, it showed the same thing, and it also showed a difference in the timing that this information should be presented. So I think if culturally appropriate, relatable educational materials, I think it's such a big thing. It sounds like a simple phrase, but it would take some research and understanding what it is people need to understand. When is the best time to present that information? Because once you hear your initial diagnosis, for me, everything became Charlie Brown. Like, I can remember the doctor like drawing things. I have no idea what she said after that moment. So the timing that this is presented is very important. I know that there was a study that was done specifically for metastatic breast cancer patients, that after they were diagnosed, it then brought them in for another appointment with someone different, just to talk through, let's make sure you understand what's happening. And so I think that's actually a great combination between that middleman and the educational materials.
I think what I'm hearing too, I mean, so I'm with Casting for Recovery, and we hold retreats around the country at no charge to women of all stages of breast cancer. And I hear what you just said, Jasmine, is the exact thing I hear all the time, which is, I thought that was my only choice of reconstruction. Or no one ever told me about lymphedema. Well, they probably were told about lymphedema, but that was so far, down the list of priorities when they're trying to pick surgery dates and treatment options. It was like, and then for the information to be culturally appropriate, and younger folks like to read stuff on their phone. Older women, they'd like a notebook that they can highlight and put stuff in. It's almost like you need an online playbook for what stage you're in that you could go in and look at. But this would be an enormous playbook because it's such a huge, it's just every step of it could have so many documents, and that can be overwhelming. So how do you make it not overwhelming for all education levels? I mean, we've got people that English isn't their first language too.
Exactly.
It's complicated.
And so when you think about like, where's the investment, I think that's something that has to be considered. If the task is too big to take on, then it's a fail. You know what I mean?
Mm-hmm.
So yeah, I share that. I share that insight. Just for breast cancer alone, the amount of materials that exist and that don't exist in doctors' offices is really big, especially when you think about, so for the rest of us in the middle of a study right now, race, culture, and clinical trial perception. And the greatest thing that I think is coming out of this is there's no one size fits all approach. Yeah. And so when you think about culturally competent doctors, that is requiring them to know a whole lot more. Mm-hmm. It's looking at things like how shame impacts Asian women, in a sense that they may not be willing to come forth with a lot of issues, but they often trust their doctors more because they're more likely to have doctors that are in the medical field. When you're looking at like Black and Latina communities, there's already a lack of trust. There's already this idea that we disqualify ourselves before we allow someone else to disqualify us. So a lot of questions aren't even being asked. I know that we've taken some of the preliminary things from the study, from the interviews, and we are using them to help reshape the way that researchers are doing recruitment pieces. So one of the things that came up was transportation issues, transportation barriers. So on the front end, let's go ahead and address that. This is how you make that happen. I think the same thing would probably need to be done with culturally appropriate materials. I think they would have to be created knowing the barriers that these communities are facing in order to make sure that the right information is being presented.
Jasmine, oh, sorry, go ahead, Kim.
Well, so I was just going to ask Susan, how are you reaching out, promoting through all different types of races, colors, ethnicities, through Casting Through Recovery? What is your approach? What is your tactic?
So we actually did an icon with Livestrong about this because so we started 25 years ago in Vermont as a very grassroots organization, and we were primarily serving middle-aged white women. And so naturally, those women who came to our program would oftentimes volunteer, start new retreats, new programs. And so we had this cycle of middle-aged white women that were becoming our volunteer base. And we've been trying to break that cycle by I'll preface that also by saying that we host about 50 retreats a year across the country. So we have little groups of volunteers all over the country that understand their demographics. So if you're talking about women of color in Louisiana versus women of color in Montana, and then the rural aspects versus the urban aspects, it's every single program has their own dynamic and differences. And so we had to back way up because, first of all, our volunteers have to understand what's culturally appropriate. we certainly don't want to do our outreach and serve. We normally serve 14 women at each retreat, have 14 women of color, and then an all middle-aged white volunteer base. That's not appropriate. And I mean, there's so many hurdles for us to overcome. But what we're doing really is we're trying to work one step at a time with the volunteers in those areas and saying, I want you to take one step. I'll help you make the introduction. Anytime we have a woman of color that attends a retreat, we try harder to get her involved, because we know that if you come to a program, and our retreats are psychosocial, medical education, and fly fishing. Okay, fly fishing is sort of, you think of, I can say this in this group, an old white guy's sport, right? It's what you think of with fly fishing. And so if a woman of color, or a woman period, if she doesn't see someone like her that's enjoying the outdoors and fly fishing, where's the motivation or the trust that they too can participate? And so in many times what I'm doing is I'm trying to bring in a woman of color who's an oncologist or an oncology nurse navigator to be on our volunteer team. We started partnering with organizations like Brown Folks Fishing to have more women of color and men of color that were participating in our retreat programs. It's bad to be super grassroots with our outreach. Sometimes there's a group that we can get involved with more easily. And then other times it's a lot of cold calls and just hoping we can get an opportunity to speak to their organization or come into a meeting. It's different everywhere. It's a really big challenge to turn that ship.
Yeah.
So,
So I'm hearing education materials more. I got a lot. You know, Susan, you've got a big task, take a big step backwards, but there's truly not, especially in your case, a true blanket pamphlet, right? That you could connect with women of color in Montana and women of color in Louisiana. I remember that icon very, very well. And one of the things that stuck out with me at that icon was with casting recovery for specifically was in my area. It's funny, I am an angler instructor. I'm a certified angler instructor with Texas Parks and Wildlife.
no way.
I am. So, and I have friends of color that I've been trying to get to come fishing with me for a long time, and they want to give me their kids. But I'm like, no, you come, and they want to know about bugs and heat and all, snakes and stuff like that. But I remember, I don't remember her name, but I remember her saying that that's different in Louisiana. The women of color love to fish. So just between my Central Texas, demographic of that women of color, and then the Louisiana ladies, like that was just different, and we share a border. So it's truly, I'm hearing education material, right? But there's not a blanket education material, something that could go on, every flyer, on the cover of every flyer, definitely. But go ahead.
One thought that I just had is that, let's say that perhaps Livestrong wasn't the person that needed to create the materials. Perhaps Livestrong was investing in creating a framework for what it could look like for other organizations. So another organization could take this and say, these are the steps that I could take to be more culturally appropriate, to create more relatable educational materials. I think that kind of toolkit would be more scalable, and it would allow organizations to create things that could be adapted to their communities, as opposed to Livestrong being the one to create the thing for everyone. Because there are some places where materials already exist, right? But they're missing the target. But I do think there could be an opportunity to invest in what the toolkit and the framework is for those communities could be.
Yeah, solution
That-
grants. So I definitely like that. I like to think of that as your, I'm giving you a high five. That's a great idea. High five. Boom. There's a solution grant, right?
I'm wondering if there are upstream effects of that. If doctors now have or nurse navigators, if the ecosystem of cancer care now had more culturally appropriate, relatable education, is the potential for an upstream effect where they begin to behave in ways that are more culturally appropriate because they are exposed to more culturally appropriate. I mean, is that possible?
Oh, yes.
What's it called? The ripple effect? Yeah.
Yeah. Right.
Yeah.
Right.
Yes, definitely.
It'd
Well,
be valuable.
Jasmine, I am interested in hearing more about your the breast of us. Tell us more about that and how this equity of care is kind of aligning with that.
So For the Breast of Us was created back in 2019. My partner and I met at the Young Survival Coalition Summit. She was diagnosed at 35 in 2015. I was diagnosed at 26 in 2016. And we both kind of connected over these shared experiences of feeling like an outlier, both as young women being diagnosed with breast cancer when everyone else is like, you're too young. And now you're in these settings where everyone is much older than you, even in the support groups. And the women were amazing. I call them like the OGs. They're amazing, but they weren't in a place where they were newly married or they were trying to figure out how to navigate a cancer diagnosis and fertility. Like all of them had grown children. We're just in different phases in life. And then on the other side of that, when it came time for me to go through radiation, I wanted to see like what my skin would respond like, because the paper said that I was gonna turn red. And I turned like black, like I was really, really dark. And you can still see this was like 4 or 5 years ago, you can still see that outline. And so I didn't feel very prepared for that process because it was written with white women in mind. White women typically do turn red, but if you have melanin, even Asian women, they turn dark like this. And then when it came time to have my bilateral mastectomy, I wanted to know what that looked like. And like the first image that I saw, like it was of a Black woman and it did not look good. And that was the only image I had for reference. So now I'm nervous. But the images that I saw of white women that were public, they did look good and there were way more images of them. And so my question then was like, are Black women not getting mastectomies? Is my doctor asking me to do something that other women aren't being asked to do? Why aren't there more images? And I think when we got to those experiences and then getting to the summit where I learned about it was my first exposure to health disparities, and it was about the representation of women of color in clinical trials. So I learned about Black women being 40% more likely to die from breast cancer, and like maybe 6% of us are in clinical trials. And it was a prominent researcher that was having this conversation, but she said it in such a dismissive way, she's like, they just don't show up. And so the women that are in the room were like, so what are you doing? Like, do you not care? And it did have this kind of effect where it's like the mortality rate has been higher for decades now. And this kind of idea, like they just don't show up, it felt like we'd been dying in plain sight and nobody cared. So when we created For the Breast of Us, it was the first step in us creating a space where we could see women that looked like us, and kind of connect over those shared experiences. And we chose women of color as opposed to just Black women because there are already spaces that are just Black women, just Latino women, just Asian women. But we felt like a lot of those places separately we're not moving anywhere separately. So let's create a space where we can like come together and push things forward. And so it is an online community. It started as a blog. And once we realized we had the attention of this community, we were like, okay, let's create some educational component. Let's do a webinar. One of the things we did was we did an accomplice training, and we call our accomplice baddies our white women that are helping to push health equity for women of color. And we create these spaces where women can have honest and authentic conversations to learn how to push the needle forward, not just for them, but for the women beside them. And one of the things that we talked about in that accomplished training is this idea of privilege and how everyone normally has some kind of privilege. And so even for Black women, I understand for me that it's a privilege. The insurance that I have is a privilege. The access to Mayo Clinic, UF Health, and D. Anderson, I'm in Jacksonville, Florida, that's an absolute privilege. And so what we do our best to do is that we look at the barriers that women of color are facing, and we do our best to help women navigate that. So if it's education, we try to get experts to come in to do webinars about education. If it's sexual health and intimacy, conversations they're not having at our doctors, how to even like fit your body after reconstruction. We do all of those kinds of things for our community, but we're not a nonprofit. We're a blog site, we're an LLC. So we do, our pillars are basically content, community, and collaborations. And the collaboration piece is bringing in other people like Livestrong that worked with us for our fertility conversation. There were options women didn't even know, they weren't presented. They didn't know that they could have some of these things covered. They didn't know that not just the preservation piece, but also the piece when it's time to actually get things, they didn't know. And so for us, it is helping women navigate those things. And like we say, our mission is to help women make the rest of their life the best of their life after diagnosis. So that's really the basis of everything that we try to do for our community.
Jasmine, I was struck by the thing about the imagery. And then so I think when we put like relatable educational materials, as you're scoping out what that looks like, the imagery is really important about who gets portrayed in this. It's so important. But then the other thing is like, I know Kim and Livestrong did not gather us here to vent, but I'm so angry about this. Like when you said they're just letting us die. Also the blame and shame behind what they're saying when they say they don't just show up. They're just like blaming and shaming instead of being curious about what barriers are keeping women from showing up to save their own lives if possible.
And I think for us, like sometimes I get emotional when I talk about it because I'm like, I've lost so many friends to breast cancer. I've lost a friend recently last year in her 40s. She has a 21-year-old daughter. She was a single mom and she died to metastatic breast cancer. And so when we're dismissed of like they don't show up, or like I've gone to presentations where they kind of frame it and it is very much so patient shaming. And then we have to back that up and say like, how many women are single moms? How many women don't have jobs that allow them to take off work like that? How many women, like there have already been some studies that show that they talk about the delay in diagnosis. Sometimes that delay in diagnosis is women that are focused on basic needs. So even when we get to October and a lot of the conversations around research, and it's like no ribbons, just research. And I tell people like, oh no, we need ribbons and research. The awareness campaigns that have been executed have missed whole segments of population. Because if they didn't, we still wouldn't have these myths and misconceptions. Women would understand the importance of coming in earlier. I tell people all the time, like, for me, I just understood breast cancer. I didn't understand metastatic breast cancer. Right. And I don't think women understand that if they're delaying going in, that this is making it worse, you know, like we all just have this like blanket idea that breast cancer means death. And so I don't know, there's so much work to be done. You know, there is. But definitely. I think so for us, what we found, like one is the materials. We definitely need that. The other thing is the importance of patient advocates that are thought leaders, that are educated. I think unfortunately, one of the things that we're seeing in our communities is that there are a lot of cancer influencers. And they're not always educated. And that's where a lot of misinformation comes from. And that's a disservice to our community. So I did love this idea of creating a network. I think We Go Health does a great job of that across different cancers. And so again, I think this comes down to if Livestrong jumps into these streams, how do they work differently? How do they differentiate themselves? Because I'm a person that I say collaboration over competition. Like there's no reason to keep like duplicating things. How can we do something that's not already being done?
Yeah.
Yeah, I'll just jump in as a board member and say, like, I don't think it makes any sense for us to do anything duplicative, right? You gotta, I'm sure Kim agrees. You
Yeah.
have to add capacity, support capacity where it exists, and augment and support and innovate, take on the risk taking for things that don't exist. But yeah.
Yeah, definitely cohesion versus division for sure.
It seems like so many places are doing great work, especially during COVID. I feel like we've seen just so many things mushroom up, like whether it's webinars, understanding COVID and the vaccine and cancer, and just people have had to pivot to virtual with their education and support. And now there's a ton of stuff out there, but I am not a cancer survivor. And if I was suddenly diagnosed, it seems to me that, so, you know, there's so many factors, whether it's to go in and be able to put in, I'm 55, I'm Caucasian, I don't have the BRCA gene, I have no history in my family, I have these other things. What do I need information on? Is it financial help? Is it transportation? Do I need some educational materials that are specific to my race or ethnicity? And there may already be something out there, but then if there was a way to navigate people to the resources that are already well done out there. So here's this stuff. Oh, and also you're a Black woman, you're a Native American woman. Here are some other things you should know since you are part of that community, or you're triple negative, or you have inflammatory. Here are some things for you to know, because it's so overwhelming. I don't even know how some people get through it if they are doing it alone, if they're a single parent, or if they live in a rural community, or if they live in a community where the medical community is being dismissive of them and saying, this is what we're going to do, instead of, wait a minute, I read about this new procedure, this new flap procedure, whatever, I'd like to do that. Well, maybe your doctor isn't trained to do that type of reconstruction. You need to go to somebody else who is trained, because a lot of times they push what they're trained in.
Exactly.
I love it. So I'm hearing material. So we're definitely on these relatable education materials, and relatable is big. So I was trying to put a visual with what exactly that means, and Susan brought it out wonderfully on some type of search with filters is what I'm hearing. Filters, you know, and you can select, like you can select male, female, right? Because you don't want prostate cancer information if you're a female, right? So just an additional filter of other, you know, criteria: Black, Asian, Native American. And I like the information that already exists, right? Because we're doing cohesion versus division, right? And there's no reason to duplicate anything. So we're outside wonderful information that already exists, brought in to where if you select that certain material, I'm a breast cancer patient, I'm about to start radiation in 2 weeks, you know, I am Native American, or and I don't know if you've seen lately, I have got kids in school, so I think some of the new registration stuff is really neat on how if your kid is half Black, and you know, you can select too. I think that's pretty neat. You know, my husband is from South America, so he's not. It was just kind of cool. I thought to be able to select more than one. You know, and I think even further, just to be able to select skin color, really, you know, okay, so yes, you can put 2 different ethnicities, but maybe you have darker skin, and then so something pops up. I think of Jasmine now, it's going to be forever burned in. You know, no one told you that the discoloration was going to be different than the white woman in the pamphlet, or, you know what I mean? I can think of, you know, reading a pamphlet about the treatment that you're about to receive, and nothing about that pamphlet was applicable to what happened to you. that's very shocking. So materials, relatable educational materials. And I love how Susan, that was perfect. Filters. Like, I feel like there's filters for everything. Everything's an online form now, right?
I don't want to miss your last point, which empower patients. So it shouldn't be overwhelming. It should make the patient feel as if they're being giving actionable information.
Absolutely. Absolutely. Because see, the one thing that I saw, and I think it was like in the brief, someone said something along the lines of, I have to be my best advocate because that makes a doctor the expert. No, we should always, regardless, we should always be empowered with the information to make the best decision for ourselves. It's not like an either or, it is an and. You are the expert, the doctor is the expert. I know that, I'm trying to remember which committee I was in. We had a conversation and I said, we never talk about quality of life until it's end of life. We should be talking about quality of life when people are diagnosed. If not, people are having to make decisions that affect the rest of their lives very quickly. How do we shift that conversation? And I think part of that begins with education.
And we have the muscle memory for that. I mean, the entire fertility stuff has come out of the idea that we expect and hope you have a life after cancer. Because why else would you bank your sperm and your eggs, right? So we have some muscle memory to pull on there about the fact that your quality of life matters today, from the day you're diagnosed through every day you're in treatment to beyond that. So
absolutely,
we should be part of that tradition and promote it and protect it.
Now, again, I think this you think about whether they have to create something new or whether this is thinking about new partnerships. I know BC Healthline, they do have an app that's community and it has these different groups. For the rest of us just joined it, just for places of women of color. And right now, a lot of their resources are things from their website, but I think the things that, and they have all these different filters, and you can even say whether you're divorced or whether you're like have children, whether you're pregnant, have all those things. But I wish there was a place where we had some AI that could recommend these resources that already exist. Things about, if you're not pregnant, do you want to learn about fertility? These resources exist. Would you like resources on sex and intimacy or in relationships or in parenting? I think it would be great to see the marriage of those things.
Yeah. I'm writing that down.
Yes, me too.
You know, I recently had to help a past participant from one of our retreats. She had a recurrence and she went in and had a single mastectomy. And because of COVID, they tried to send her home same day. Oh. And she said, she was in so much pain. She convinced them to let her stay one night. Single parent, kids, her mom had COVID, which was her caregiver.
Oh,
and
God.
Somebody reached out to me and said, she's in Houston. She needs some help and she needs some help fast. And you know what? I struggled to find out where to go. I knew she needed some transportation help. Sure, she could call an Uber. She needed financial help. She needed help navigating what's next. She got sent home, with drains, the whole 9 yards. Single mom, 2 young kids, caregiver can't help her. And I was like, this is like the perfect storm of horrible things that could happen to someone. And I was having trouble navigating things in Houston because there is so much out there. I'm leaving messages. And finally I was like, you know what? I can leave messages, but I'm just going to start calling women I know that live in Houston that have been through this and say, who helped you most? Where can I send her? This is what I need help with. And they started calling, but it was challenging and overwhelming and super time consuming. And she didn't have the strength, energy, or time to do that for herself. She just kind of gave up and was just sitting there trying to get her kids to school to go to her follow-up appointment. And I was like, this is not right in this day and age. It's insane.
That's insane. And that you're creating a fire bucket brigade. I mean, like, that's insane.
Yeah, it was crazy. And a lot of go to the American Cancer Society. Okay, well, they're overwhelmed. I'm leaving messages. Folks may not call back for a week. I'm like, she doesn't have a week. You know,
No.
we ended up sending people over to her house and just trying to help her. It was like, she's just sitting there so stuck, so uncomfortable, so just done.
Yeah.
But if she could go to an app and see, okay, where can I go get some help right now? Who could help me with this right now? Or can I at least whittle it down to
Yeah.
maybe it's a national org who can then tell me where to go locally. I don't know.
Right. Right.
So in my mind, so guys, like that's the way my brain works in like these big ideas. I don't necessarily have like all the ways to make it happen. But right in my mind, my day job is with United Way. I work in Northeast Florida, and my side job is for the rest of us. But United Ways, they have an initiative called Mission United. And people can call in through their regular 211 hotline. And if they're a veteran, they can get the special services and case managers and things of that nature. In my mind, I don't understand why we couldn't have a partnership that does the same for the cancer community.
Yeah.
That allows for people to call in to get these case management services, because United Ways already have the database with all the resources. It's a matter of having someone in place that can do that follow, because not everyone's going to have a nurse navigator. Because in that case, I probably would have called a nurse navigator, right? Not every hospital has that. But I definitely think there's opportunity in the cancer community to make some alignment and partnership so that there can be something like a Mission United that serves the cancer community with that case management piece that helps connect people to resources.
Mm-hmm.
Almost like a clearinghouse.
Yeah.
Yes.
Of sorts.
Yeah. But has to be multilingual and text able.
Yes.
Mhm.
And they have that. I know there are some United Ways that have already started doing the texting, but they do the multilingual, absolutely. And I think that's where we talk about the importance of digital literacy and the digital divide. But again, that brings people back to a place where how we can use technology to better serve communities.
Right.
Definitely. And as working a lot of the navigation here at Livestrong, I have learned that the 211 is not the same across the nation.
Mm-hmm.
And that's, incredibly frustrating as well. So just cohesion across that, to where if you call 211 in Northeast Florida or in Austin, Texas, that you're not going to feel lost or like that was a waste of time. In either location, it needs to be, and again, bringing those services across the board together versus trying to create a duplicate. No more duplicates. It reminds me of what is that movie, The Gremlins? Where they add water to that thing. Stop adding water to it. That's just what I want to say. Stop adding water. No, we don't need any more gremlins. Let's just stick with the one and just make it great, right?
Absolutely.
Okay. For sure. Okay. So there was a second part that I heard, patient advocates that are educated and of color.
Mm-hmm.
Let's revisit that, because it's kind of on that last bullet point. You know what? I'm going to stop sharing because y'all are small, and I'm still sharing, right? So that last bullet point is create a network of people from the community others can trust. And a lot of times that is a person who is educated and also of color. I happen to have a very big network of doctors that are also friends because my husband's a nurse. And I have found that if the doctor speaks Spanish, that is an additional brownie point of trust, right? Whether that doctor is not Hispanic or not, just and they may butcher it, but they're trying. And, I feel like just that barrier of I am trying to connect with you because I'm trying to butcher my Spanish and communicate as best way I can with you really does a lot. However, what does this look like as far as a solution? How do we even connect these people? What does this look like? So the patient advocates that are educated of color.
One thing I'll say that I think is absolutely makes no sense, especially for Latina patients to still be facing language barriers in healthcare, is just amazing to me. But in this day and age, we do have devices that can help translate. And like, I don't know, are there services that need to make these more available? Because I feel like they should be in doctors' offices for sure. Like it feels like, again, this feels like people being treated as afterthoughts. So that's just something to throw out there. But so one of the things that I think about as I'm thinking of how I develop a training for our community is that there are a lot of organizations that do pieces of it well. But I haven't seen an organization that is doing all of it well. And so this organization might be really good at explaining the science of breast cancer. This organization might be really good at explaining the clinical trial component of understanding breast cancer. This organization is really good at sharing like the advocacy, like how to use your story to make a difference, that component of breast cancer. But what I'm seeing is that there are a lot of women that aren't learning beyond their personal experience, and they're getting one of those pieces. And the rest of it is kind of like, this is just my opinion on what I think. And that becomes very dangerous. That's where a lot of misinformation comes from. And advocate communities, patient communities are where people go to get information. So to me, I think there does need to be a more holistic approach to the way that we train advocates and put them back out in the community.
What does this look like? I imagine a website, cancer, human beings of color and cancer, or something like that, a website. And I imagine, like how you're saying, these modules of, and I completely agree. And one of the big things being Hispanic, and I've never had cancer, but I had been a caretaker multiple times of family members, is the nutrition, right? And then the patient shaming as well, going into, if you don't change your way, you're going to be re-diagnosed, or reoccurrence and stuff like that. So definitely have encountered that. And so yes, so if we had something where we did bring this from this doctor's office, or this specialist, this oncologist, or this trusted person into one space, and stop pouring water on the gremlins, and we can have just one space of something great. That's what I imagine. How are you envisioning bringing that out?
The way that I've done advocacy trainings before, I've done some in-person ones, and that was back in the day, pre-COVID. It was pretty awesome though. And we were in a classroom with other women, and we had these different sessions, understanding different components of advocacy and things of that nature. I've done online certifications for understanding clinical trial development. I think in this day and age, self-paced online is probably the way to go. I think it probably makes it more accessible to people. But at the same time, I do think there has to be, because you do self-paced, you record it once, and then like you just let it play out. But I do think there is a need to have group discussion at some point. And I've seen that work well in the ones I did for clinical trials. We did self-paced, and then we did also come together some time for group discussion. I think that was great. And and like certifications, like not like I went through this Livestrong program. These are different things that I covered. What will that allow you to do? What does knowledge allow you to do? And some places it allow you to be on IRBs, and some places allow you to be a research patient advocate. So I think having those benefits established are also really great. And then that means Livestrong then becomes kind of the authority on what cancer patient advocacy looks like, right?
I love it. Self-paced. That's so good, because you do it when you want to, how you want to. You know, that's so good versus signing up for a class, something happens, you forget about it, you know, or the reminder gets lost in an email.
Right.
Oh, that's huge.
Well,
Yeah.
also it's more, we've already discussed how like Susan's beautiful example, well, both of you actually, that kind of the desperation of diagnosis and how lost in the process you can get. So then being told you have to be here at a particular place and time is not patient friendly. It's also not friendly from an equity standpoint. So I love that you're trying to really think through what's helpful instead of constraining or a burden.
And
I
the
also
group oh, go ahead.
I was going to say, I also think that there's huge pockets around the country where I feel like it's just deserts of information and training. And so if it's online, it's accessible by someone in, you know, rural Alabama, rural Montana, Wyoming, North Dakota. I mean, I hear stories of women that are like, the nearest support group is 300 miles. Of course I do it online. And I found my tribe online. I found my people, and now we're all going to get together for a vacation when COVID is over. We've never met, but I finally spoke with someone else under 40 that's had breast cancer, because they're just out in the middle of nowhere. Same with nurse navigators and advocacy reps. I mean, they may be in a place where there's the continuing education certainly isn't really there. And is it culturally appropriate? Probably not, if they've just got bare bones support. So online, I think, is crucial.
Would it, do you foresee any of this in a doctor's office, like a flyer or anything like that?
I think do you mean for the participants, or do you mean for the folks we want to train, like the navigators?
Either. I think of how, you know, the connection. I don't know. I think of, you know, and personal experiences and what that would look like. And I think going back to a person of trust, I don't know. But anyway, that's just me thinking out loud.
I think going through like the Association of Oncology Nurse Navigators, where people are going onto Facebook or Instagram and seeing, oh, Livestrong's doing this new thing. It's self-paced, it's online. I would love to do that. I think going through some of those orgs that are specific might be more useful.
The other utility of that is that we know our healthcare systems are in a crisis, the lack of capacity, everything. And they're dealing with a lot of delayed diagnoses because of the pandemic, and the data is starting to get scary on that front. So I agree that with Susan, that finding the group of practitioners who are desperate actually to get their patients more information and on their own time is the right, because this actually helps them too.
Right.
If done well.
Very much so.
I'm excited. I want this now.
Yeah, let's do it.
And we talked about the high five. The high five is a little bit slow sometimes. High five and go. So we may high five, and then the and go comes later, and it's even slower. But we'll definitely, good stuff. Good bumps to work with. I love it. The groups I've been in today have been small, but they have been powerful, just like this. Yes, just to, I was in a nutrition one this morning, and definitely powerful. I think it gives everyone an exclusive time to really chat and let those ideas flow.
Mhm.
I love it. So we really focused on the materials. Materials, I think, and I don't remember who said it, but talking about an app, I agree. Whoever had said that, there's just so many, right? I do feel like that. There's just so many. So I feel like an app would take advertising and all that, all that other kind of stuff, but just the materials. And then I think of, okay, well, what does materials look like? I think of, a flyer. I've got this sitting on my desk, like, would it look like that? No. But I love the filters, something digital where we can filter very specifics, and then have some great information outside that necessarily have to be within, right? Because there's so much great stuff that already exists. So bring that in, to populate whenever you hit those filters, for sure. Empower the patient. I love that. We really need to empower them, give them that power, feeling of power, along with the caretaker, not feeling overwhelming. Actionable information. That's huge. I talk to cancer patients all day, and that's what I do. And that's probably the number one thing that I kind of try to calm them down with, like, I'm sorry that this has been so overwhelming with you. And they can be at, it doesn't matter your stage, whether you're just diagnosed currently in treatment or, 1 to 5 years out, there's something along the way. So if I say one thing the most every day, it's, I'm so sorry you're overwhelmed. Please let me try to help you. I love this one. Quality of life matters at diagnosis, not at end of life. Not just at end of life.
Not just, yeah.
That is so big. So big. That's huge, right? So all of this information, I love the marriage of information that already exists. I have that really big, bold marriage of it. The patient advocates that are educated and of color. I love big comma, and of color. But I kind of don't necessarily disagree, but with the and of color, but I've just seen so much barriers come down with patients when doctors just take that little bit of extra time to really be like, I know I'm not the same color as you, but I am trying. And again, it goes to that education. I wrote that down somewhere. Where it were the materials and the doctors, the education needed to be knowledgeable about the different cultures and the barriers within those cultures, because there's different barriers in different cultures, right? The Hispanic barriers are different than the Asian barriers, all that kind of stuff. So that's huge too. Group discussions within that, the self-paced online. I love that. I feel like COVID, the pandemic, has really brought so many support groups. I have sent so many people to this local lymphedema support group that essentially, now that they are digital, I can send anyone across the country. You don't have to be in Central Texas to be a part of a lymphedema support group. And lymphedema education and support, I feel like, was scarce to begin with. And now you've just kind of lifted that word scarce off of it because you can be part of it. So definitely the group discussions, along with the self-paced. So you take that education and you bring it on at your own pace. Yes, I've got so many. I scribbled all of that down. I'm so proud of me while y'all were talking. I loved it. Anything else you want to add? Let's I don't want to miss anything. Such great information.
Kim, maybe after, I have lymphedema and I'm being treated for it in Austin. So I want to make sure you may be sending them there. It's a whole resource center and they offer all kinds of treatment and education and nutrition classes and exercise, but I want to make sure you know about it so that you can send people there too.
Oh, okay. For sure. Yes.
Yeah.
I Dr. Angela Ramos, I happen to know her from when I worked at the YMCA.
That's who's
And-
treating me.
Oh, that's so awesome.
Yep. That's her. Yeah. I ran Livestrong at the YMCA for 7 years.
Oh,
that's-
fantastic.
Yeah, I'm a former YMCA employee. Yeah, and that my main baby was Livestrong at the YMCA. So that's how I became aware of what Livestrong was. And unfortunately and wonderfully at the same time, due to COVID, we were laid off.
Yeah.
There was a huge layoff with the YMCA, us full-timers.
Yeah.
Just at my Y alone, we were 45% gone. Anyway, so I definitely know Dr. Angela Ramos, and she is so fabulous. And that online support group that they have going is so great. Yes, happy Friday, everyone, wherever that you are across the nation. But happy Friday from Central Texas. Thank you so much for joining us in our Equity of Care. And I will bid you farewell, but not for too long. Hopefully we'll connect very soon digitally and virtually. Alrighty.